Hi, my name is Dr. Carragans, and I want to talk to you about just what the title says, how to treat TMJ. Now, first of all, let's talk about what is TMJ. Many patients out there complain about pain in their jaws, a difficulty in opening and closing their mouth, an inability to bite into a sandwich, a large sandwich, a clicking or popping sound when they open and close their mouth, severe headaches, neck pain, sometimes even vertigo and tinnitus, or ringing in your ears. All of these symptoms may be related to what used to be called TMJ, which is really another name for this myofascial pain dysfunction syndrome. It's really a problem with the jaw joint, where your upper and lower jaw meet when you open and close your mouth. And you can feel it when you open and close your mouth. Now, a lot of factors come into play when you start talking about the joint, no different than any other joint in the body. But this is an unusual joint because it's bilateral. It's on both sides. You see, your elbow and your knee are unilateral. They work, independent of one another. Your right and your left leg, your right and left arm. The temporomandibular joint, one side relies on the other to function properly. If that becomes unbalanced, problems arise. Now, years ago, I ran a department at one of our local hospitals, and we started a TMJ program, and we were very limited both in diagnostic ability and in treatment. Diagnostic, our tools really were basically related to symptoms the patient presented with. Someone came in and said they had pain. We would listen to the joint with a stethoscope maybe. We'd watch their mouth open and close, do some other minor things, and then if they had pain, we would try to treat it. Now, we didn't have many other diagnostic tools at the time. Treatment was also very limited because we just didn't have a lot of treatment tools. So we would either put people on long-term medication, pain pills, sometimes muscle relaxants, sometimes a combination of both. And typically, we would also put some kind of intraoral in the mouth splint, dental splint, that took the pressure off the jaw joint, so you couldn't grind and clench your teeth as much. But that was it. And most of these treatments needed to be long-term because once you took them out, the pain came back. Now, a small percentage of patients had arthritis of the jaw joint, etc., and they might have required surgery or some other things, but that's a very small percentage. The majority of people, it's basically an imbalance, and that imbalance can be caused by a variety of things, including accidents, slip and fall, car accidents, the dentistry that's in your mouth, bad habits, clenching and brushing your teeth, stress, all these things come into play. But the reality is it's just an imbalance in your jaw. The right and left just aren't working right. Now, if you have that in your leg, if your right leg is sore, what you'll do is you'll lean on the left. You become unbalanced. Eventually, your left leg gets sore. Same thing in the mouth. If you have a pain on one side, you'll favor that side, overwork the other side. That becomes a habit, and now you're out of balance. Now, a lot of the problems we find are related to muscle pain that are due to this imbalance of the jaw structure. So, what do we do today? Well, today we have great diagnostic tools. Some of these tools are actually used in medicine, sports rehabilitation, physical therapy, and we found that some of these tools are now we've been able to bring them into the dental field to help us with head and neck pain. And it's not only the jaw joint; it's also neck pain, shoulder pain, and headaches. All right, headaches. All of this relates to very similar problems, similar issues, and we now can treat these. Most importantly, we're now able to diagnose them. So we have tools, very sophisticated tools that give us information. So not only do we know what's wrong, we know who we can help. You see, there are some patients we can help because they have certain issues that are unrelated to these problems. The majority of patients we can help. And once we ascertain that we can help you, we also now have tools that enable us to go ahead and treat you much the same way they are treating sports athletes, etc., people who have had accidents, things of that nature in rehabilitation medicine, using such things as ultrasound, cold lasers, microstimulation, microcurrent stimulation, things of that nature. Now, these all sound very fancy, and some sound a little bit difficult. And just want to assure you that everything we talk about is non-invasive. There's no pain associated at all. Most of it feels kind of cool because it feels kind of nice. It's more of a spa type treatment, but all of these treatments are meant to relax the muscles, get rid of those little knots that are in those muscles, get your face and head and neck balanced. And now, once again, we have tools to find out what you like at the beginning, and we can find out what you like when we're done and make sure that the treatment has been successful. So you don't have to wear long-term splints, and you don't have to be on medication the rest of your life. So long and the short, if you're suffering from chronic headaches, if you find that 2, 3, 4 times a month You just got to stay in a dark room. Whether you call them migraine, cluster headaches, tension headaches, not important. If you have constant headaches, if you have pain in your jaw joint, if you have difficulty opening and closing your mouth, if you can't bite into a big sandwich, any of these factors, if you have shoulder and neck pain, if you can't find your bite, we hear that all the time at the office. I can't find my bite. If you have any of these symptoms, give us a call. We can go ahead, put you through a brief diagnostic test, see if indeed we can help you. And if we can, put you back on a path so you can start living your life again without constant headache, without having these problems. That's what this is all about. We use a system called the True Dentist system. It's been used in this country for about 6 years with a 93% success rate, because once again, we know who we can treat now, and we know what we can do to keep you whole. So give us a call, 877-626-9269. I always forget the number. 626-9269, 877. My name is Dr. Cary Gans. We're located here in Garden City, New York, on Long Island, right adjacent to Roosevelt Field. So we're convenient to all the major highways. The Long Island Railroad's a couple of minutes away. We have a lot of parking. We're here early and we stay late, and we're here to help you in any way you can. If you want to give us a call, we'd be happy to sit and chat with you initially and see if indeed this is something we can do to help you. And there's no cost for that initial consultation. It's my pleasure. At some point in your career, you realize you've got to give back to the community that's kept you whole all of your career. So that's what we're doing. If we can help you, then we'll put you on a path to making you live your life again the way you should. It's not, get a good night's sleep. No time off from work. No locking yourself in that dark room, and be able to enjoy your family and friends. Give us a call, 877-626-9269. Have a great day.